Welcome. I'm very excited for our guest today and kicking off our inaugural series. I'm Dr. Jamie Wells, and this is for Genesis Medicus Clinical Campus. We're doing an all things medicine multi-series, but here's for our intro. And as part of talking to the leaders in the program. Today we have a very special guest, Dr. Cesar Palana, who I'm going to introduce and do my best not to get too tired from all of the wonderful, exciting things that you have done, and the diversity of your background is so interesting. Especially you went to college in Connecticut, then medical school in University of Santo Thomas, Faculty of Medicine and Surgery in Manila, Philippines, and then University of Hawaii for internal medicine residency in Honolulu, Hawaii. I'm a huge fan. Medicine is very regional, so your exposure to so many different parts of the world and back in California is so great when it comes to patient care. But Dr. Palana is a board certified internist or internal medicine for students. So he has his medical degree and he's also a CMD, which is a certified medical director. He's currently wearing a number of hats. He's CEO, president, physician. Among his affiliations is in Long Beach Healthcare Center in Long Beach, California. He's part of academic faculty undergraduate medical programs at CHA Hollywood Presbyterian Medical Center and Mission Community Hospital. He's a director of medical education, clerkship director for internal medicine, and attending as well in the Department of Medicine. He's former chief medical officer, hospitalist, a chief informatics officer, which is so invaluable today, especially with the way of digital electronic health records, interoperability. I mean, this is the future and things. So I can't wait to dive in a little bit to your expertise in that domain. He is Director of Medical Education and Internal Medicine Clerkship Director for GMCC. You also do extensive amounts, being very savvy with social media and outreach. And I have a quote about you that you're an asset in today's evolving educational landscape. So I'm looking forward to diving into that further as well. You also have been an academic scholar at Halloran Center for Community Action and Public Policy, combined scholar with Yale New Haven Hospital and Yale University, where I'm an alum. So I would love to turn over to Dr. Palana. It is such a pleasure to meet you, and I can't thank you enough for, in the middle of seeing patients, joining us to further education for students. Welcome. Thank you for
Thank you for having me, Dr. Wells.
Thank you. So one of the things that I've mentioned is the origin of Genesis Medicus, for someone who took Latin involuntarily, then voluntarily, and ancient Greek is the origin or birth of being a healer and a physician. And I would love to hear your origin story of what drove you to the medical field, in particular, how you evolved into your chosen profession of internal medicine, what that looks like, and the trajectory of that for student benefit. But really, what brought you into the medical landscape?
Well, science is my passion since pre-medical careers. I used to be pre-law
Oh,
first year,
wow.
and I was fortunate enough to be full scholarship in Connecticut. So I started with pre-law, did not like it. So I fell in love with science and decided to go with pre-medical route. And the reason why I decided to do internal medicine is because I've realized that academia is my passion. And internal medicine really covers the breadth of medicine. So that's the reason why I chose internal medicine as my residency program of choice.
Those who are unaware of how internal medicine is disparate from family medicine and the like, can you cover kind of what the residency is and what that looks
Sure.
like and what diseases and what the joys that you find of it and how hospital medicine is different than outpatient, etc.
So internal medicine is more focused on hospital medicine. It's more of acute, high acuity of care, not your bread and butter ambulatory. So majority of our focus in our training is really living in the hospital. So we cover breadth of subspecialties. Each month we are rotating in different subspecialties like endocrinology, ICU, pulmonology, etc. So we're really trained more on the higher acuity of care, including procedures that's done in the hospital setting.
So if you like the versatility of medicine and
And the
intervention,
unpredictability,
I
that's the one.
and I've always heard as well, you never know what's going to walk through the door, which keeps it very interesting for you.
That's I tell students if you love watching House, if you love the pathophysiology aspect of diseases, then you would love internal medicine because that's what we do on a day-to-day basis. You will never be bored. There's just so many things that you can do in internal medicine. It's not just one liner. It's really, there's so many comorbidities out there. It's so complex, and I enjoy it. I enjoy it because of the complexity of it.
I recall watching some documentary and seeing, and I found this in different, I started in neurosurgery before switching to pediatrics, but I remember in particular watching some documentary on Hawaii and
Hmm.
trauma injury with surfing and the like, or there are so many different conditions in different areas. Were there surprises when you came to practice in California versus being in Hawaii?
To be honest with you, I've learned so much in Hawaii because not a lot of people know that we are the first stop before they set into a U.S. hospital.
Oh,
So a lot of these undiagnosed cases that they deal with in the Polynesian Islands and Southeast Asia, etc., they come to us first. So we do see a lot of rare cases in University of Hawaii, and it's a university program, so it's very academic, it's cutthroat, but we're very well trained.
that's always a joy in in medical training. And actually, that's a nice pivot to for advice for medical students and things. What would you convey about how to facilitate the success of medical students in, a lot of times we're trying to balance their different personalities. What should their expectations be when they run into challenging, one of the doctors that I talked to today remembers a time where there weren't restrictions on how many hours residents could work and things, and I kind of remember that time too. And you could encounter certainly the sweetest and most nurturing or more challenging of folks in the training process. What are your recommendations for medical students in terms of how to resolve conflict and how to, um, foster resilience, but also be able to know what behaviors are good to emulate or not emulate throughout the course of their training?
From what I've learned so far is that as far as emulating, I do have multiple mentors, and I don't absorb all of their personalities and qualities. I just nitpick exactly what I feel is good, and I put that into practice. So I don't. I try to be who I am, and I just choose what is good for me from them. That's what I learn from them. I don't learn 100% of the qualities that they have, but I just choose a little bit of that, and then that is how I evolve as a clinical practitioner.
And with respect to internal medicine clerkships
Hmm.
themselves, how can a student be successful are there do's and don'ts? Are there certain expectations they should have if they want high honors versus pass versus what are the characteristics or things that you're looking for them to achieve their goals in that way?
For me personally, it's more of the evolution. I like the before and after. I like the drive, the motivation. I like hard work. And so if it shows that they are really doing the best that they can, the effort itself is already a it's already a big plus for me. It's not really how much they're making. Obviously, the score is wonderful, and that's what I really prioritize during their stay with me is how to get a better score for your step two USMLE. But what I really try to evaluate them is the before and after, how they are in their first week with me and how they are when they exit with me. Because I'm lucky enough to have them for 6 weeks.
Oh, well,
So really, I have them for the half of their IM rotation. So I get to see their evolution, and it's the it's their journey with me that is something that I really hone in, and that's what I include in my evaluations for them.
they learn how to do a history, physical. Are there particular conditions that tend to be your bread and butter for the medical students when they're doing their core clerkships?
Basically, one patient is at least four core IMs. So
Mm.
it's, yeah. I'm fortunate enough to be more on the geriatric population, so they do see a whole lot just by seeing just one patient.
I no, you can learn a tremendous amount. My father had four cancers in 9 years. He used to say that he was my only, as a pediatrician, he was my only geriatric patient. And there, you can learn so much from so many different populations. Are there resources that you think specifically can arm them to succeed in internal medicine? Are there things that optimize the rotation that are the big go-tos?
Well, I like efficiency. I've learned that I should not be doing the same didactic every single time as they switch. So what I do is I do more of flipped classroom where I post my videos on YouTube.
Right.
And I
I
tell,
was going
yeah,
to talk more about that. I would
yeah,
love to hear what you're, clearly there are many people who feel with respect to social media, friend or foe, and I see a
yeah,
friend over there. I think that all of these tools of communication can be used for good instead of evil. So I would love
yes,
that you've been quite successful in your approach with social media. How do you view that in breaking down complex topics? And what's your
sure.
philosophy with regard to that? How can that be used as a tool?
I so I my teaching style has evolved as well. I have to be very relevant to the TikTok mindset of today's learners. I do believe in micro learning, and that's really the only way for people to really absorb the material. So that's why I like to do a lot of YouTube shorts and Instagram reels, just for that reason. As far as long form videos, I do post that on YouTube. So that's easier for me to say, all right, today we talked about hyponatremia. So I told my students to view my hyponatremia my video the night before, and today we just put on the whiteboard. I gave him some numbers on different labs, and they would tell me the differential diagnosis and the actual diagnosis. So it's more application the day after, based on the video that I have posted online, and they like that better because it's more application based than really just sitting down and listening to someone do a PowerPoint presentation.
Where you had used some expression, it was micro and repetitive has shown, was there
Yes.
something that had shown could you speak to that briefly?
So the way I teach is more spaced repetition. So I ask the same questions over and over again, not every single day, but in a series of maybe 2 or 3 days, and then I'll ask it again the week after until they really get it. And those spaced repetitions are more high yield concept that I know for sure it's going to show up on their exam. And if I know for sure it's going to show up on the exam, I tell them that this will show up on your exam, and it's been validated. They do tell me sometimes it does show up, so I try to tell the next groups that to really make sure that you know this material. As far as micro learning, it's more of just 5 minute spiel here and there on the topic. I don't like to teach for more than 10 minutes because
The rate of
that's
return diminishes.
no, exactly. And it's just gonna waste of everyone's time if we really just sit there for 30 minutes. Gone are the day that you sit in a room for 30 minutes each time to learn about pneumonia. That never works anymore. So I like to more provide more of an on-demand, on your own time learning, and then apply the next day.
And what do you find most rewarding about precepting?
Because I learn as well.
You have to stay.
I'm pressured to know more than I should. Because as you know, we don't have a lot of time. I have a busy practice. I run my own practice. So but it's a hobby. It really is. You have to really enjoy teaching for you to uh, teach effectively to the students.
I've been asking about fun facts about you that help with your stress management and relief. Or is there any? I've got pilot, diver, shark diver, which as responses. Any
Uh-huh.
suggestions in terms of how to manage uh, keeping the stress at bay or dealing with it, and any
Uh-huh.
fun fact about you, and then a final thought, of course.
No fun fact about me. I'm a very
Not
boring person. I'm not a pilot diver. I used to be a
either.
surfer back in the day, but not
Oh, okay.
anymore. But I do I mostly run. I try to uh, you know on my own time just try not to do anything medical one day in a week. And I feel like if I am hitting a break, that I would do something else. I would again run is my my release. I don't have anything else to offer you than that. That's an honest that's an honest answer.
You
I,
probably, I think people don't recognize that you take exams forever. I don't know what is the continuing medical education requirement in internal
it's
medicine? Do you have every 10
it's every
years?
10 years, yeah. It is.
And, so no, running is a good thing. Anything that can
Yeah.
distract your mind. No,
hmm
I'm so grateful that you're here. Any final thoughts that you think is important for people, or what you've seen in the evolution of medical education? Are we going in the right direction? Are there exciting things on the forefront?
I think there are exciting things in the forefront. There's just so many resources out there. So I think you just have to really choose what are the valid ones. And that would be my final point. Not everyone is a credible
Source.
teacher. source, so I would choose the right ones. And if you don't know if that's a good source, I would ask around.
Thank you so much. This
Yeah,
was really lovely of you to take the time. We're happy to
you're
meet
welcome.
you, and I'll have to come be an intern for a day.
I would love that.